Orthopedic Spine Institute. It's February 10th, 2026. Our patient presents from Pittsburgh. He has back pain. He's had a fusion done. The fusion was done at 05S1. He now has pain above and below his old fusion. So we are diagnosed him with piriformis syndrome. We have diagnosed him with SI joint pain, and we have just facet pain as well. We've just completed the treatment of the SI joint, and the piriformis is being done right now. So we're going to show you guys what it means to have piriformis muscle pain, why it happens.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deukmedjian release. From there, the piriformis pain is permanently eliminated. The advantages with the Deukmedjian release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Folks, we're done with our piriformis release, just like that. 4mm incision, back of the hip, release the scar tissue within the muscle, and that fixes the piriformis syndrome. It's a permanent fix. We've not had patients come back. It's one and done usually. And you can't see the muscle, but when I'm releasing it, you can feel scar tissue within the muscle. That scar tissue shouldn't be there. Muscles normally don't have scar tissue in them. The fact that it has scar tissue tells me that that muscle has inflammation, and it's developed scar tissue over time. The scar tissue tracks along the direction of the muscle fibers towards the top of the hip. That's where we release it. So no bleeding, no hospitalization, no downtime. This is an in and out procedure. It literally takes 10 to 15 minutes. It's done under sedation with the patient sleeping because it hurts to do it otherwise. And the patients go home about 15 minutes after the procedure. So he's going to go back to Pittsburgh tomorrow after he sees us in the morning for a quick checkup. But today we treated his facets, his SI joints, and his left piriformis. Any questions?
Just one question from Ab Diaz on YouTube.
Sure.
Asking, I am a neurosurgery resident. Do you have a fellowship? I really appreciate your work, sir.
I appreciate your watching and understanding and learning. You know, I was a neurosurgery resident a long time ago. I trained in Gainesville at the University of Florida when it was the top program in the world under Dr. Albert Roten. It's changed now, but I did not get exposure to any of this stuff. Anytime we had patients with back or neck pain, we consulted anesthesia, pain management services. They would come by and do shots or pills. And of course, the patients would be in pain for the rest of their life, right? Because these pain sources don't resolve on their own. And so it wasn't until I got out of training and started practicing on my own that I realized that back and neck pain could be cured with the right treatment. And that's kind of where you are, learning those treatments, those invasive treatments, unfortunately. And you're probably learning about stimulators too, which never cure anything. But currently we don't have a fellowship for these treatments, but I recommend you come back in about a year. And what we're trying to do is get better insurance coverage for these treatments so that we can expand our services to more people, during which time we're going to require more doctors to be trained. But right now our volume is not high enough to train other doctors. We don't have the surgical volume yet. And so I expect that someday we will. But thank you for joining us. I'd like to know where you're in your neurosurgical training currently.
I will keep that question keep the answer chat box going once we get to the testimonial, and I'll let you know when you come back.
Thanks. Thanks for joining us. I'm here with a patient who underwent the Deukmedjian release. This is a minimally invasive procedure to treat the third most common cause of chronic back pain, which turns out to be a torn buttock muscle. This is a muscle below your gluteus maximus, deep inside, and it's called the piriformis muscle. It turns out this muscle is really short and very easy to tear. Once it's torn, it just never heals, and then you just keep aggravating it with activities. And what was life like for you with this piriformis syndrome before your surgery?
Not good. Pickleball was affected, just want to say that. So that was kind of the deciding factor. And this was after trying dry needling, PT, you name it. I've done it.
Why did you come to Duke Spine Institute to get your back?
Because I had you 6 years ago.
Tell us about that.
Had back issues, a lumbar. I have spondylolisthesis, degenerative disc disease, stenosis. It looks bad on pictures. I had really 4 neurosurgeons recommending anywhere between a 3 and 4 level fusion. And I still did not buy it. I went a year and a half just researching. And I don't even know if you know this. I literally stalked you for 6 months on Facebook and asked you so many questions until I felt comfortable. And that's how we got here.
And are you glad that you came to Duke Spine 6 years ago to get your back fixed?
Oh my goodness. My husband can probably give a better testimony than I can, because he had to watch the pain that I was in. So
he suffered too, but you were pretty desperate 6 years ago. Life was pretty dark for you at that time, wasn't it?
Very dark.
And there are a lot of people out there who are in that same boat right now. What would you say to those people?
Oh, don't wait. I waited a year and a half. That was longer than I should have.
And you were on the verge of giving up.
Yep. Surgery is not paid for by insurance. Tried to run it through Blue Cross. They would not. It can be expensive. But looking back in the life that I've had since then, you can't put a number on it.
No, you can't.
And even now, I really waited too long. I've had this for a while, thought I could fix it on my own. And I'm not kidding you, that pain from the surgery is nothing compared to the piriformis pain. And I should have done it a long time ago, waited too long.
So you came back to Duke Spine Institute from Phoenix, Arizona, right? You had your piriformis release done at Duke Spine.
Yep.
How do you feel after your piriformis?
Oh my goodness. I mean, like night and day. I can't wait to ride. I have not sat stationary in one spot, and I can't even tell you. I constantly am adjusting my weight.
Because of the pain in the buttock?
Yeah.
And is it still there, that pain?
No.
Gone.
Completely.
That's right. Because the Duke piriformis release is the best treatment in the world, the safest treatment, and the most effective. It lasts a lifetime. Once we do it, it takes literally 15 minutes to do the procedure under twilight sedation. And you had it done. There's a little bruising, but that's it.
Yep.
And now you're back with no restrictions, and you're going to have a normal life. All right. Anything else you want to share with your fans out there?
He's the guy. Seriously, he's the guy.
Well, it's great to see you. Safe travels back
Thank you.
home, and thanks for sharing your story. Yeah.
Thanks.
Come here.
Yeah.
I get it.